Good day, everyone. So today we're going to tackle about the ethical issues here in the Philippines, which is I'm going to tackle about the healthcare access. So let's start. Many Filipinos and especially those living in poor and remote communities struggle to receive proper medical care. Some hospitals are overcrowded. Some patients cannot afford treatment, and others die before even receiving help. This issue became more serious during COVID-19 pandemic, when many people were denied hospital beds, oxygens, and medicines because of poverty and lack of resources. So, this issue is connected to ethics because healthcare is considered a basic human right. Every person deserves proper treatment, regardless of social status, money, location. About money, they lack of money because they don't have income, especially those people in the mountains. They don't have access, they don't have passable roads. Especially, I'm going to mention indigenous people, which is I'm one of them. We are living in the mountains. But we have house in the which is the population like that. And one thing I have noticed here that is a problem, not in just our barangay, but it is in the whole food. It is in our whole country that we're experiencing healthcare access. Every person deserves proper treatment regardless of social status, money, location. As I said, however, in reality, not everyone receives equal care. Rich people can easily go to private hospitals, while poor families often wait for hours in public hospitals or choose not to seek treatment because they cannot afford it, or they will going to use some herbals, something like that, to treat their sickness. And that hurts as a Filipino because I've seen how my kabarangays experience it, and also those other people here in our country that I am seeing online. It hurts so much. And to analyze this issue, I will apply the philosophy of Immanuel Kant. Immanuel Kant believed that people should always be treated with dignity and respect. According to his moral philosophy, every human being has value and no one should be treated merely as a tool or neglected because they are poor. Kant also believed that actions are moral if they follow duty and respect human rights. So, applying Kant's moral philosophy to this issue, denying poor people proper health care is immoral because it fails to respect their dignity as human beings. If hospitals or society only prioritize people who can pay, then equality and justice are ignored. Healthcare workers and the government have moral duty to care all citizens fairly, not only those who are wealthy. And also, another philosophy we can connect to this is John Stuart Mill. John Stuart Mill is a utilitarianism, which means actions are good if they produce the greatest happiness for greatest number of people. From this perspective, improving public healthcare services is moral benefit because it Moral because it benefits more Filipinos and helps society become more healthier and stronger. Providing free vaccines, affordable medicines, and accessible hospitals can create better outcomes for many people. So, in my opinion, the current inequality in healthcare here in the Philippines is not moral. Why? Because many Filipinos suffer because they do not have enough money for treatment. Life should not depend on financial status. The government and healthcare institutions should strengthen public hospitals, provide affordable healthcare, and ensure equal access to medical services for everyone. So, I can say that as a future nurse, yes, as a future nurse, and responsible citizen, we should learn to value fairness, compassionate, and respect for human dignity. Ethics teaches us not only what is right and wrong, but also how our decisions affect the lives of others. Healthcare should never be a privilege only for the rich. It should be a right enjoyed by every Filipino. We all deserve accessible healthcare, and we should have it because we deserve it.